Give enough to give Allison some time for her presentation. I just wanted to get us started. I wanted to thank you everyone for coming today to this really interesting and useful lecture about nutrition during cancer survivorship. I'm Sharon Manny. I'm co-director of the Cancer Survivorship and Outcomes Center, and I'm really happy to have you here today. Next slide, please. So this is a series of talks. The talk today is from Allison Roselli about nutrition, but go back to the first slide, sorry about that. But on our first slide, you can see we have a couple more lectures coming up in the next four months. And if you're interested in any of those, just let us know. There'll be the similar kind of notification on your MyChart or on Twitter, however it is that you found out about it. We'll continue to advertise, but the topics really range from psychological distress, special issues with young adults, exercise for cancer survivors, and a lecture on lymphedema. So I'm hoping that if you're interested, you'll sign up because it's a really great lecture series. I just want everyone to know that we will be able to store this on our Cancer Survivorship website. So if you're interested in that, just let us know and we'll send you the link when we send you the follow-up. And if you want to look at the tape, it's on there. Or if you want a tape of this lecture, you're welcome to it as well. And without any further ado, I want to introduce, next slide, poor Allison's doing the slides as well, Allison Roselli, who is a radiation oncology clinical nutritionist and dietitian at RWJBarnabas Health here at the Cancer Institute of New Jersey, and we're really grateful to have her here today. Take it away, Allison.
I think this is some additional information about those upcoming series. If anybody's interested in learning more about it, welcome everybody to this talk tonight. My name's Allison, and there's also a questionnaire that I'll leave on the screen for a couple of minutes if you'd like to fill it out, I assume.
You guys will get it. You'll get it through email afterwards. If you want to fill it out, great. It also contains the information that we'll be sending to everybody who's here today.
Okay. I can also come back to it at the end of the talk in case anybody missed it right now. All right. So there is one more slide.
That's the website. And that's a copy of the pamphlet that everyone will be getting. I'm sorry, you guys. I didn't introduce all the slides because I wasn't controlling them. I'm sorry about that. This is the pamphlet you guys will be getting on an email afterwards.
Thank you so much. All right. So now I will start my presentation about just nutrition during cancer when you're in either prevention or in survivorship. So as I was introduced, my name's Allison. I have a master's in human nutrition from Drexel University in Philadelphia, and I did a year-long dietetic internship to prepare me to become a dietitian and work in oncology at the Cancer Institute of New Jersey and Robert Wood Johnson. So I'm going to be reviewing the top recommendations from the American Institute of Cancer Research and from the World Cancer Research Fund. They have done continuous and progressive research on kind of the best nutrition advice to maintain your nutrition status to help reduce the risk of cancer reoccurrence and also to prevent cancer from forming. So their research is the same for both risk reduction and for cancer prevention. Their top recommendation for everyone across the board is to maintain a healthy weight and to be physically active. Too much body fat can increase cancer risk. It's importantly the visceral fat that's located around the abdominals or the waist. It can lead to increased inflammation and too much hormone processing, and that kind of just leads to the possibility of cancer formation. So by maintaining a healthy weight and being physically active, you can prevent that inflammation and that formation of possible cancer cells. So the way we do that is to find a healthy weight range for our body type. That's the weight range where you feel healthiest, where you feel strongest, where you feel that you are able to exercise and live a full life. That weight might not fall into the BMI range that you're told, but that's definitely something that you should focus on for how you're feeling in that weight range. So ways we get into that weight range is to eat a healthy diet. We avoid sugary drinks. We're mindful of our portions. We're physically active. If we have a sedentary desk job, we're trying to get up and take walks around from that desk job, and make sure we're taking 15-minute breaks every so often to get our body moving. And the overall goal is to move more, sit less, and just keep it up and be positive. We also want to have a diet that's high in vegetables, fruits, beans, whole grains. The American Institute of Cancer Research recommends what they call the New American Plate Model, which is on the screen here. So the New American Plate Model emphasizes more plant-based and vegetable choices on our plate, excuse me. 2/3 of the plate is what should be whole grains, vegetables, fruit choices, beans, and then the remaining 1/3 should be an animal-based protein source or a non-animal-based protein source. It can be fish, poultry, dairy, and occasionally red meat. You want to focus on the portions of your meals. You want to make sure that protein portion is around the size of the palm of your hand. And you want to make sure that starch or whole grain portion is about 1/4 of a cup to 1/2 of a cup, depending on where you're choosing that starch to come from or that whole grain to come from. Adding foods that are rich in antioxidants and phytochemicals, things like apples, blueberries, broccoli, any type of cruciferous or crunchy vegetable is going to be helpful in full of these phytochemicals that we're talking about that can help reduce the risk of cancer. Coffee is an excellent option. Cherries, flaxseed, all of these vegetables and fruits that are listed are great ideas to increase and add to that New American Plate Model. So antioxidants, they're thought to help protect our cells by removing free radicals in our body before they can cause damage and lead to cancer cells. And phytochemicals are thought to reduce the risk of cancer, but we're still learning a whole lot more about their possible protective effects. Next, you want to really limit the consumption of processed foods, red meats, and sugar-sweetened beverages. You don't have to avoid these foods entirely. What we talk about when we're saying we want you to avoid them is to eat them in moderation. I'm not saying you can never have a birthday cake or a slice of pie at a holiday again. It's that enjoying those foods at those times are appropriate. And you should continue to live your life fully, but eating these foods in moderation. Foods that have a high amount of sugar, starch, fat, foods that are fried or in deep oils should be limited. Sugar-sweetened beverages in very mindful portions, and red meat and processed meat meaning sausage or cured meats, bacon, food options like that, they should be eaten very rarely. 12 to 18 ounces of red meat a week is the recommended allotment from the American Institute of Cancer Research. Additionally, when we cook meat, cooking it over a very high temperature or on a grill where it gets that char can increase the amount of nitrates that are on that food and therefore can possibly lead to an increased cancer risk. Well, again, I don't think you should avoid eating it entirely. It's all about eating it in moderation and reducing the risk of these foods. When it comes to alcohol, the best recommendation is to avoid it and completely abstain. But if you do drink, being mindful of your portion sizes. 1 drink per day for women is the standard recommendation, and 2 drinks per day for men is the recommendation. What's more important when we're talking about drinking is the serving size of a drink. They're roughly 1.5 ounces of any hard liquor, 5 ounces of wine, and 12 ounces of beer. That's what counts as a 1 or 2 drink per day for women. When we're talking about supplement use for cancer prevention, I hear quite often things like more is, if some is good, more is better. This is a way that I make sure I'm meeting my needs. However, we do have some concerns about the supplement industry. The FDA does not currently regulate all of the dietary supplements that are available. So the American Institute of Cancer Research does recommend that you avoid any type of specific supplements for cancer prevention. They might help fill a specific nutrient gap if you have a diagnosed deficiency, or if you're aware that you don't eat a lot of the food that contains a specific vitamin or mineral. And in that time, it might be appropriate. But making sure that you're looking for a quality seal, something from the NSF, USP, or the Consumer Lab, a third-party evaluation to tell you that it's a safe supplement and has been proven to be what it is. You definitely want to aim to attain all of your vitamins and minerals from the food first. Getting your nutrients and phytochemicals and antioxidants from food is going to be the easiest way for your body to absorb those vitamins and minerals, and it's also going to provide you additional benefits as well, so things such as fiber and calories and protein and just good nutrients. If you're a pregnant woman or a postpartum woman, breastfeeding is very protective for both you and for your child. Breastfeeding will help lower the mother's risk of high blood pressure, type 2 diabetes. It's been shown to reduce the risk of ovarian cancer and even pre- and post-menopausal breast cancer. For the baby, it's what we consider liquid gold. It really helps build a strong immune system, and it does possibly reduce long-term cancer risk by decreasing the risk of obesity. Now, formula is wonderful as well. It does provide essential nutrients for the baby. But again, in terms of reducing cancer risk, you definitely want to try to breastfeed if you are able and if it's possible for your lifestyle. So I'm going to talk a little bit about cancer site-specific research and how the American Institute of Cancer Research has kind of been gearing their research to see if there are specific nutrition interventions we can make that could have an impact on a specific cancer site. So some of those recommendations and some things that I hear quite a lot are like, now I'm going to be a vegan. I'm going to follow a very strict vegan diet, and I'm going to see how that impacts my cancer risk. So what research is showing us is that the men who were following a vegan diet were 35% less likely to develop prostate cancer, and they had in addition, they had a lower risk of advanced prostate cancer. For women, while a vegan diet did show a trend of a decreased risk, there's really not enough evidence to support a lower risk for breast cancer at this time. So a vegan diet, just to be clear, is someone who does not consume any animal products. They don't consume dairy, egg, or any meat animal products. So what about fish, poultry, dairy? What if I want to eat those, but I don't want to eat any red meat sources? So that's what we would consider either a pescatarian diet or a lacto-ovo-vegetarian. A pescatarian diet includes fish, poultry, sometimes dairy, and sometimes eggs. But usually it's just fish, chicken, and plant-based sources. So pescatarian diets, when we compare it to a full vegetarian diet, showed a possible decreased risk for colorectal cancer. So there is a possibility that having increased red meat in your diet could lead to an increased risk of colorectal cancer. which is what research has kind of been showing us. A lacto-ovo vegetarian, someone who only eats milk and eggs, when compared to someone who does not consume any milk or eggs vegetarian diet, they had a lower risk for digestive tract cancer. That's anything from your mouth all the way down to your rectum. So when we're talking about, should I eat fish, should I eat dairy, should I eat poultry, should I completely remove any animal-based products from my lifestyle, it's a good rule of thumb to see if that adjustment is possible for you to make. Will it lead to increased distress for you? Or do you have the capacity and the time to make that full switch? Research shows that there is some benefit to following these vegetarian, pescatarian, or vegan diets, but at the end of the day, it's going to be what's most sustainable for you to make that change. So after treatment, nutrition impacts can kind of continue to happen. They can be long-term effects that happen for a few years, and they can also have short-term effects that are happening for a few months. I wanted to address some of those nutrition impacts that could kind of continue to happen and ways that you could address them. So one of the main symptoms that I hear during my daily routine and just from patients in general is that they experience a lot of fatigue. They're really tired and it's hard to get their energy up. They have a loss of appetite, and sometimes foods just don't taste right and they don't want to eat them anymore. That's all perfectly normal and one of the longest lasting effects from what I've experienced. So some suggestions that I have for patients, and I make them all the time, is to make preparing foods easier on yourself. Use canned foods, frozen foods, ready-to-eat foods that are easily available and even easier to prepare. Canned and frozen vegetables, canned fish, canned chicken, they all still have all of the nutrients that are available to you as they would from a fresh. The science has advanced significantly, and I recommend eating canned foods, frozen foods, anything to make it easier for you to prepare those. You also want to keep snacks available and with you. So if you are hungry, you have something readily available for you. Or even if you're not hungry, but you know it's time to eat, you have a quick and easy snack available and you don't have to think about it too much. If you're having difficulty and you're struggling to prepare the food because you just ate, you're feeling nauseous, the smell of food is really difficult for you, making sure that you're trying to prepare your food when you're feeling good, when you have more energy in the day. If you like to eat breakfast at any time of the day, make that a meal that you have more often. Breakfast for dinner is a delicious and nutritious food. And it's a great idea for an evening meal. If you find that your appetite's best in the morning, try to plan your biggest meal for the morning. And as always, making sure that you're drinking plenty of fluids to maintain your hydration. Staying hydrated is an excellent way to make sure that you're still hungry and that your body's feeling full of energy. All types of fluids count. This can be juice, it can be coffee, it can be tea, it can be water, it can be flavored water. They're all excellent options as long as you're keeping yourself hydrated. Something I also experience or help with a lot is weight loss and not eating enough. It all ties into that lack of appetite and that fatigue as well. So something you can try to do is to eat your high protein foods first when you're the most hungry. They tend to be the most filling, but the most important to your meal. You also want to add high calorie foods to boost your intake when you aren't very hungry, making sure that you're focusing on adding calories where you can so you get the most bang for your buck when you don't have a big appetite. If you're eating your largest, as I mentioned before, you want to eat your largest meal when you're most hungry. If that's your lunchtime, that's when you eat your biggest meal. If it's dinner or dessert, that's when you're focusing on taking in the most of your calories, because that's when you're going to be able to eat a significant portion of your calories. If you're having difficulty with taste changes or food just doesn't entice you as it used to, change your food, try a different recipe, go out to a new restaurant that you've been excited to try. When I talk about changing your food, think about trying a vegan diet or a vegetarian diet, or maybe you've always wanted to try the Mediterranean way of life, or Indian food has always been something that you've never been possible to try, but you're really interested. Go out on a limb and see if these new flavors appeal to you more than your current or usual diet pattern. Stomach concerns can also last and kind of come and go, feeling very nauseous or mainly just feeling really nauseous. So eating foods at a room temperature, having them cool off before you eat them can help to alleviate that aggressive nausea or those strong smells that might trigger it. Being out of the room when food's being prepared can also be helpful. If you're preparing your own meals and just cooking is just too much, it makes you super nauseous and you're not able to eat your meals after you cook, consider looking into prepared meals and delivery services, such as Meals on Wheels or Mom's Meals. Some of these programs even work with your insurance, and you might be able to be covered for people who are going through anti-cancer treatments or even post-cancer treatments. You want to try to not drink with your meals, especially if you fill up very quickly. That's going to make you fuller faster. And avoiding foods that are fatty, greasy, fried, or very sweet. Those can trigger nausea as well. It's always important to maintain your food safety, but it's especially important if you've recently finished cancer treatments or are still actively going through anti-cancer treatments. You want to make sure all your fruits and vegetables are very well clean and before you prepare them. Before you cut them, before you slice them, before you cook them. You also want to make sure your the cutting board that you use to cut your meat is separate or different from the one that you use to clean your fruits and cut your fruits and vegetables. It's still important, as I'm sure most of us have been avoiding buffets related to the ongoing pandemic. You want to avoid them buffets or self-serves just to make sure that your food is always at a safe internal temperature, and also you're not touching multiple handhelds that other people have touched, just to maintain that your food is safe and healthy for you to eat. If you don't have an internal temperature thermometer at home, I recommend trying to find one or locate one. Or purchasing one. You want to make sure that things like beef, veal, and lamb, pork, ham, or even fish and shellfish are cooked fully to an internal temperature of 145 degrees. Any type of ground meats, sausage, and eggs should be cooked to an internal temperature of 160 degrees Fahrenheit. And any type of whole chicken or turkey breast or other types of poultry would need to be cooked to an internal temperature of 165. These vary slightly depending on your preferred temperatures and things like that. And of course, you can always cook them a little bit more, but these are the standard internal temperatures to make sure your food is fully safe to eat and there's no additional bacteria or concerns. I also wanted to address some frequently asked questions that I hear during my daily routine and during any presentations that I've given before. These are like commonly addressed myths and things that we hear that have recently had new research come to light to kind of help advance and answer these questions. What about soy? So there's been some concern that soy is something that should be avoided. And a couple of years ago, that was a standard recommendation. However, because we've been continuing to do research, and the American Institute of Cancer Research specifically has done a lot of research on soy and long-term effects of it and populations that eat a majority of it, soy is recommended to eat regularly. Consistent research has shown that there's really no increased risk for breast cancer. And there's, so sorry, there's even more limited evidence that it's now showing that there's a greater overall survival and a decreased risk of recurrence for eating about 2 servings of soy a day. Again, just like with those supplements, more is not better. You want to stick within that recommendation of 2 servings of soy per day to have that the best benefit for decreased risk and overall survival. Should I eat organic foods? Do I have to eat organic foods now that I have a cancer diagnosis or to prevent a cancer diagnosis? The American Institute of Research shows that it's really not necessary. It's not a super black and white answer, and we are still doing a lot of research on it. However, our largest study did show that it's more likely a larger variety and a higher quality of fruits and vegetables that's leading to the healthier lifestyle and a lack of associated health problems that could lead to that reduced risk of cancer. So if you can afford it and it's something that you're really passionate about, go ahead and eat organic foods. However, if it's something you struggle with and you're not really sure, it's not a necessary recommendation. So when is weight loss not okay? Sometimes I'm seeing people who are happy that they're losing weight. Some people are not so happy that they're losing weight. During active anti-cancer therapies, and even when you're recovering from just after anti-cancer therapies, it can be really hard on your body and the mind. So weight loss can occur really quickly at this time, especially if you're doing a harsher treatment. When weight is lost this rapidly and this quickly, it's usually not fat loss, but more of a lean muscle loss. When you lose muscle this quickly, it leads to tolerating treatment less. It just becomes a little harder. You have an increased risk of falling, generalized weakness, and more fatigue. Additionally, most anti-cancer therapies are focused on weight. They're either weight-based or composition-based. And so sometimes when you lose weight very quickly, it can lead to an adjustment in your therapies. Some weight loss is appropriate. I strongly recommend working with either your medical oncologist or a registered dietitian to identify when and how much is appropriate for you at whatever time if you're interested in weight loss. Again, we want to find that healthy weight range where we're feeling strong, healthy, and confident in our body's ability to live a healthy, active life. Does sugar feed cancer? Bottom line, the answer is no. Sugar feeds all of the cells in our body. And while it does not specifically cause cancer cells to grow, and it doesn't feed them directly, there is a higher risk that when you're eating a high sugar diet, you have a possibility of increasing more fat, especially that abdominal fat, and therefore increasing your cancer risk that way. The theory that the sugar feeds cancer comes from specific scans that we do and just our previous understanding of how the body functions. But again, right now, our bottom line, sugar does not feed cancer, but you should still choose to eat sugar in moderation. So after addressing these concerns, these nutrition myths, and just some kind of frequently asked questions that we hear all the time, I'd also like to take a moment to address where your nutrition information is coming from. There's so many sources that we hear from. Every time there's a new research study, the news can pick it up and they can make an example of it. And there's a clickbait article. There's so many social media articles and influencers who have a whole bunch of opinions on what nutrition is. There's TV and there's internet articles, there's blogs, there's a whole lot of information out there. My general rule of thumb, if it's too good to be true, it's likely too good to be true. Claiming that you can lose 20 pounds in 2 weeks, 500% of your daily needs, juice cleanse away all the toxins in your body. All of these are really well-meaning advice that comes from people, but also you want to make sure that it's credible information that you're taking away, that it's evidence-based research that's been done and proven to help a majority of people, not just one or two every so often. Another good rule of thumb is that if they're trying to sell you a product or a service, usually the product is what is for sale. It's not and the motivation is profit. It's not your health. You want to be making sure that you're focusing on what feels good for your body. So what to look for when you're researching nutrition advice and where to find that good ideas. So you're going to want to look for expert opinion, and you're going to also want to look for research studies. That expert opinion is going to become based off of those research studies that have been completed, they've been looked at, they've been peer reviewed, multiple people have proven it again, and it's just where we're pulling that strong information from. So I like to end on this note. I have some additional slides, and I did want to leave a lot of time for questions, which I clearly did. But so my quote that I like to end on is, the common facts of today are the products of yesterday's research. So just like with that soy example, where our research is now could be completely different from where it is in 10 years. And I know for a fact it's very different from where it was 10 years ago with cancer and nutrition research. So just keep learning and keep looking for those expert opinions and that good advice.
Does anybody have any questions? There's one that
on it. So this is upcoming research that we can go through. There's not a whole bunch of information on it. As I said, we like to have evidence-based, proven recommendations to make for our nutrition statements and nutrition therapy, but I thought it would be interesting to review them with some pros and cons. So the ketogenic diet is a diet that was created to help people who are experiencing epilepsy. So the specifics of the diet is that it limits carbohydrates and it increases your fat intake, and it changes your body's fuel source over from glucose to ketones. So the thoughts are that the positives of this diet might reduce inflammation specifically in the brain. There's a possibility it supports mitochondrial health and decreases the oxidative stress in your body. And there's a possibility it could slow cancer growth through inhibiting your insulin system. The cons, though, is that to maintain being in ketosis is a very difficult process. It's very time intensive, and you have to make sure that you're very on the game with monitoring your foods and your intake and even your beverages that you're drinking. Also, there's really not a lot of long-term research on this diet right now. We're not sure how it affects your body after you've been following it for 20 years or so. What happens when you stop following this ketogenic diet? This diet has been exclusively researched for many years on how it impacts patients who are experiencing epilepsy, but we're still kind of identifying what the long-term effects of it. It also commonly causes weight loss, which is usually not a recommended byproduct during treatment. Intermittent fasting is something that I've heard a lot of questions about as well. So there's a couple different types of intermittent fasting. One is time-restricted eating, alternate day fasting, and a 5-and-2 fast. Time-restricted eating is that you only eat for a certain block of time every day. Say it's from 2 p.m. to 6 p.m., and then you don't eat the rest of the time. Alternate day fasting is you eat every other day and fast for the days in between. 5 and 2 fasting, I believe, is that you fast for 5, you eat for 5 days and you fast for 2, or it's opposite. So the pros of the research is showing that there's a possibility that it can reduce the glucose in your blood and also therefore the insulin, which can help keep your cell metabolic health. There's also the calorie restriction, which if there's no glucose in your cells, if there's calorie restriction, it's therefore thought to have an effect on tumor progression because there's no fuel in your body for any of your cells. The cons are that it usually leads to low blood sugar, which means you're tolerating treatment less, you're tired, you're not feeling 100%. Some of your medications or some of any medications need to be taken with food, and therefore intermittent fasting can have a significant impact on your medications. And again, it also commonly causes weight loss, which is still not recommended during treatment. Another really hot topic in pretty much any nutrition field nowadays is the gut microbiota. We're talking about how it influences the DNA, gut flora, and how food and the gut work together. So some research is looking into whether it could possibly decrease how tumor genes are expressed, or if it increases the tumor genes, the tumor suppressor genes, because we do have genes and cells in our body that do fight off tumors and cancer cells. Does taking prebiotics help increase the gut flora, or is it probiotics that are more helpful? Is it postbiotics that are most helpful? There's a lot of research being done as when is the best time to influence your gut microbiota, and how does dietary fiber play into this? Does it increase specific fatty acids to nurture and strengthen our colon cells, our gut wall lining? Does it increase, have probiotic effects? Does it have prebiotic effects? These are all research topics that are currently being looked at for the gut microbiota. And some possible cons of using gut microbiota in terms of cancer prevention is there's really hard to establish how our genes are going to be displayed in our gut microbiota. It's a very hard field to determine and to experiment and to do research on. The most trials that we have so far are really high dose with really short-term effects. We're not really seeing a lot of long-term health data at this time, similar to the ketogenic diet information. And most importantly, we're all from different areas. We all develop differently. We all had different childhoods. We all have different adult lives. And so every gut microbiota and biome is severely different from each other's. So what can be said about my biome is totally different from what can be said from yours. And so how do we take all of these different lifestyles and these different microbiomes, and how do we give a general recommendation for the population in regards to cancer risk reduction? So are there any questions about kind of this future research and nutrition information?
Does anybody have any other questions? It's really interesting. One question I had in addition is, like, when do you think you would know that you should see a nutritionist, like to go in for some sort of consultation? And maybe this is a stupid question, but I always thought, well, when do you decide you really could use some help?
That's an excellent question. And I would say that you should see a nutritionist or a dietitian when it's starting to impact your ability to eat and your focus on eating. If it's causing you significant concern that you are struggling to find foods to eat, that you're not feeling healthy, that is when you should speak to a dietitian. Most insurances do actually cover general dietitian visits, and most dietitians are well versed in kind of general oncology nutrition advice. You can find a dietitian to work with either by contacting the Cancer Institute, but also by going to eatright.org. Eatright.org is where you would find a nutrition professional, and they would be able to list all of the dietitians in your area who could answer these questions. And again, which ones take your insurance? You can also contact your insurance company, and they'll be able to help you identify a dietitian to work with as well.
Is dry mouth another thing that you see, or is it just in head and neck survivors to get radiation?
Excellent question. So dry mouth is something that's usually specific to head and neck cancer patients. It can be long-term with either recovery from surgery, from radiation, and even possibly with chemotherapy as well. Dry mouth is one of the longest lasting nutrition impacts regarding head and neck cancer. The best advice I have for the people who are still experiencing that side effect is to keep water with you at all times. Keep your mouth very well hydrated, and to keep it clean also. Continuing to do oral rinses as necessary. Anytime you have kind of bacteria growing in your mouth, by not keeping it as clean as possible, leads to a possibility of it getting even drier and just bad breath and bad experiences.
Thank you very much. Does anybody have any parting questions? We haven't, oh, thank you. I'm glad that the person who has head and neck cancer doesn't have it. It's a really hard side effect. I wanted to thank you. I think we all thank you for the treasure trove of information that you gave us. As I said, we will be giving you the website, our pamphlet on some of the services, and we will be giving people, what else am I missing? A referral to the website, and I think we're answering a few questions. And in the long run, if you're interested in some of the other seminars that we'll be giving over the course of the next 6 months, just let us, Jacinta, know, or just look out for your MyChart, hopefully your MyChart reminder, or through social media. And I wanted to thank everyone for coming. It's very interesting. And thanks for spending your time to share with us your experiences. Happy New Year, everybody.